Hi, everyone, and welcome to the MIT Health Seminar Series. My name is Caitlin McCourt, and I work as the Director in Community Wellness at MIT Health. I'm thrilled to be joined by our presenter and Chief Health Officer, Dr. Cecilia Stuopis. At MIT Health, we believe that your health and well-being extends beyond the exam room, and that's what this series is all about. We want to connect our patients and our community to our talented team of care providers. In addition to the seminars, we invite you to explore all the ways that we can help support and care for your health and well-being. You can learn more by visiting health.mit.edu. After today's session, all attendees will receive an email with a short survey. We appreciate you sharing your feedback with us, and we encourage you to share any topics that you'd like to see in the future. I'm pleased to announce and turn it over to Dr. Stuopis. As our Chief Health Officer, she provides strategic, clinical, and administrative leadership for MIT and MIT Health. She's a board certified and practicing obstetrician gynecologist, and she's also an MIT alum. She's very involved in the MIT community. She served as an educational counselor. She's a board member for the Association of Independent Living Groups. And as a former MIT varsity volleyball and softball player, you can often find her cheering on students from the stands. So without further ado, I'll turn it over to Dr. Stuopis to guide us through today's important topic. And a reminder, we are recording today's seminar, so we encourage if you have any questions, pop them into the Q&A and we'll have plenty of time to address them at the end. Dr. Stuopis.
All right. Thank you, Caitlin, for such a wonderful introduction, and welcome everyone to today's seminar. This is a very important topic, and it's very near and dear to my heart. And you might think, well, why would it be near and dear to her heart? She, delivers babies. But, through the course of my career, even delivering babies, I have been grateful to know that patients of mine have had advanced care plans in place. So, to move to our next slide and to share the agenda. Today, we're going to be covering these following topics. What are advanced care plans? The things you need to do and think about to get started, choosing your healthcare proxy, planning your conversation, some next steps, and then we'll provide you with some helpful resources at the end. And hopefully at the end of that, we'll have time for to take some questions. Please, as Caitlin said, put questions into the Q&A and we will take them at the end. So you might be asking yourself, why in the world is MIT Health having this seminar today? And it's intentional. April is Healthcare Decisions Month, and just last week we celebrated National Healthcare Decisions Day on April 16th with an event in the Bush Room to assist members of our community with filling out healthcare proxy forms. The goal of the day and of this month is to really educate our community on the importance of advanced care planning. And we want to encourage all of you to express your wishes regarding your healthcare and to, for us as healthcare providers, to make sure that we have everything we need to be able to respect your wishes. Because as Benjamin Franklin said, in this world, nothing can be said to be certain except death and taxes. Now, taxes have come and gone for this year, last week. Death, none of us knows, but we should all be prepared for both. So what are advanced care plans? And this is a very common question. And there's a lot of terminology out there. We will talk a little bit about how advanced care plans are thought about in the Commonwealth of Massachusetts. The concepts are the same no matter where you live or where you do take care of your advanced care plan, but you want to know what's going on where you live. These are instructions that others would follow on your behalf if you are unable to make decisions for yourself. And the purpose of this is to make sure that if you have opinions about what is happening with your healthcare and you are unable to speak for yourself, that your wishes are respected and followed, regardless of what they might be. And this is a very personal topic for most individuals. my advanced care plan will not look the same as Caitlin's advanced care plan, and it would not look the same as your advanced care plan because we all have different things that we value and that are of importance to us. The key thing is that your wishes and desires are just that, your wishes and desires, what you want if you were to be in this circumstance. And in order to make that happen, in Massachusetts, we fill out a legally binding document called a healthcare proxy form. So advanced care planning begins by considering what you want for yourself. And this is very difficult, I think, for people to think about. Thinking about your own mortality, most people don't really want to think about that. We all think that we're going to live forever. It's a hard thing to think about, and it might make you feel sad, and that's normal and healthy. But it doesn't mean we shouldn't think about those things. And if we're really being honest with ourselves, most of us have probably had some thoughts about these topics. As it relates to advanced care planning, however, the things that you have in your head need to somehow make their way out to the people that love you. And that's where the communication comes into play. Letting the people who love and care about you, who might be responsible for making these decisions, know your wishes is going to help them, and it's going to help you. And this is especially important for your identified healthcare proxy to know what your wishes are. It's important to know that you are not alone. Things can happen to all of us, and these things like accidents, a sudden and very quick terminal diagnosis, they are unexpected and unpredictable, and really can happen to anyone. And you probably know someone who that has happened to in your own life. One of the things that planning can do, though, is if you were to be affected by an unpredictable and sudden occurrence, the planning would be in place so that somebody would be able to speak for you and make sure that your wishes were carried through. And so the time to do advanced care planning is actually before you need to have advanced care planning. It should be done when you are healthy and can really thoughtfully consider what you want and have those conversations ahead of time, long before you need an end of life care, ideally. So this brings us to the topic of a healthcare proxy. And this was the event that we held last week to help people with filling out the form. What do we need to do to fill out the healthcare proxy form, and what do they do? First of all, the best way to think about a healthcare proxy is that in the event you are unable to speak for yourself, for example, if you are unconscious for some reason or incapable of speaking for some other reason, they know what your wishes are and are able to communicate them on your behalf to the healthcare team taking care of you. So they can speak with doctors, nurses, other members of the team. They have access to your medical records if necessary for them to understand what is going on with your current medical situation. And they use what they know from the conversations that you have had with them to make decisions about tests, procedures, treatments, if you become too sick to make those decisions for yourself. And at the end of the day, they help to ensure that your wishes and preferences are carried out to the extent possible. One of the harder parts of this is thinking about who you can select as your healthcare proxy. And this is, very important and weighty stuff. So you should pick a person that you trust and with whom you have a relationship that you feel confident that they are going to be able to do what you ask them to do. You need to be able to have a conversation with that person. Now, that doesn't have to be in person. It could be through Zoom or FaceTime or old-fashioned way on the telephone. I guess that's probably old-fashioned in today's day and age. And you want to add that person's information to your official documents. So in the event that you were to end up in a situation, that the healthcare team would know who to reach out to speak for you on your behalf. So your doctor and your healthcare team are involved in this as well in terms of receiving some of this information. Now, this is where the terminology comes into play. Healthcare proxies go by other names in other states. So they can be called a healthcare agent It can also be called a power of attorney for healthcare or a durable power of attorney for healthcare, a surrogate decision makers. It's all set out by the sort of the jurisdiction you happen to be in. And we can talk a bit more about that later, perhaps in the Q&A, what that looks like. So we have this video that we'd like to share with you. It's going to last about 2 minutes, but I think this can, maybe clarify for some of you the kinds of people that you might want to be thinking about in terms of your healthcare proxy choice.
Be your healthcare.
Sorry about that.
Be your healthcare proxy? Like if you need someone to tell the doctor what to? I just go with whatever the doctors say. I wouldn't want to bother them. They're so busy. Doctors know best, right?
Be your healthcare proxy? Sure, I'd be happy to. If I'm in town, check out my Instagram pics from Peru. Wish you were here.
Oh, I could never let you go. I can't even throw a plant away. As long as it's got one little green leaf. I'd be like, can't we upload her to the cloud?
Well, heck yeah! I've given this a lot of thought. Let me tell you what decisions you're best off going with. You never let them resuscitate. And if they even try to hook you up to one of those breathing machines, never! I got this! I totally got this!
How can you even talk about this? I can't, okay? I just can't. Mom, it's not like you're gonna die. No, I can't talk right now.
Oh wait, did I show you that meme from iFunny? The cat and the dishwasher? Oh my gosh, okay. So the cat's like, bleh. And then he's like, wah! Oh wait, sorry, what?
Well, hon, you and I have been through so much together. Here's what we'll do. We'll sit down, we'll get a cup of coffee, and you tell me what matters to you.
Well, it wouldn't be easy. I mean, I'd be sad, but I'd have your back.
I remember when we went through this with Mom, we really spoke for her. So I think I can do that for you. Let's talk about what you would want.
I hope you enjoyed that. I think we all have a David, a Rachel, or an Ella in our life, but we sometimes might take a little bit of thought to find the person. And the things that we're thinking about when we're choosing are, will they make decisions that follow our wishes? Are they able to make decisions in an evolving situation that might require quick thinking or quick decision making? You might wonder, should it be a family member? It doesn't have to be a family member. Maybe many people do pick family members for their healthcare proxy, but for some others, it might be more comfortable to have somebody who's not so closely related to them. Does the person need to be over age 18? The answer for that is yes, and that's going to be true really in any state in the country, that the person has to be of age, so over 18. And then, do you need a backup person? We do recommend a backup person in the event that we can't reach your healthcare proxy, that there's somebody else that we can reach out to. So, we talk about having a conversation. Really, if you're going to have a backup person, then you would need to have two conversations, and it might not be together at the same time. You would, perhaps have two separate conversations. So this is where we get into the portion where we're thinking about and we want to talk to you about the kinds of topics you want to think about before you have your conversation with or conversations with people who are going to be your healthcare proxies. So part of it is, how much say do you want to have in your medical decisions? We all know people who are very activated and involved in their medical decisions, and others who really are very willing to allow the medical team to make recommendations and follow through on those. What concerns do you have about various kinds of medical treatments? Do you want to be intubated? That is, have a breathing tube if you're unable to breathe on your own? Should healthcare professionals perform CPR if your heart stops? Do you want a feeding tube? These are all the kinds of questions that kind of can come up. Do you want medical treatments that could impact your quality of life to prolong your life? How concerned are you about pain? Do you want pain medicines even if they make you less alert and aware? Other examples include, do you want the healthcare team to use their judgment about their care, or should they follow your wishes to the exact letter? Do you trust your healthcare team with every single choice? Now, in some of these emergency situations, you might not have picked out your healthcare team because you ended up in the emergency department, for example, after an accident. So you get who is there that day. And so that may look a little different than if this is some sort of a more chronic condition where you have been working with a certain set of doctors about your care. Should your healthcare proxy share the details of your condition with others? Are there people that you want to be invited into to these moments, or are there people that you would want excluded? There are certainly patients who have people in their life that they absolutely do not want to be involved or even know about what's going on in their healthcare. So that's important to outline for your healthcare proxy. Where do you wish to spend your final days? Is this at home, in a healthcare facility? Do you want the environment to be as peaceful and soothing as possible? I've known patients over the years who the one thing they wanted in their final days was fresh flowers every day. You can be that specific. And then when the time comes for you to pass, what should that look like? Do you want to be surrounded by your loved ones? Would you rather be alone? There are all kinds of, would you like a religious blessing or ceremony to happen before you pass? These are all the kinds of things that you can talk about with your healthcare proxy. Once you have thought about what you want and have come up with a short list, shall we say, of individuals who can serve as your healthcare proxy, then it's time to really think about having the conversation. How do you want to have that conversation with your future proxy? Where do you want to have it? Where and when will you have a follow-up conversation? Sometimes these topics, you can't really fully dig into them in the course of a single trip to the coffee shop, shall we say, or over Thanksgiving dinner. So you might want to have more than one conversation to really flesh out what you're thinking about, what you want. And the more often you talk about these topics with the people who are going to be involved in your healthcare, if you can't speak for yourself, the more comfortable you will be that they will make the right decisions, and the more comfortable they will be making those decisions on your behalf. You want to be able to, at the most basic level, explain what their responsibilities would be if they agree to be your healthcare proxy, and that they are going to be comfortable with that role. Now, we saw in the video that there were several of the folks in that video who were not at all comfortable with being a healthcare proxy. That was very clear. So you certainly want to make sure that the person that you think would be good also thinks that they can serve this important role for you. And most importantly, they need to understand what is most important to you. Another important point is that once you've selected your healthcare proxy, and you all have agreed that that's what's going to happen, it is often helpful to share with other important people in your life who your healthcare proxy is. It's easier for your loved ones if they know ahead of time who will be responsible for making decisions on your behalf, and for some people, they might be upset that they weren't selected to be your healthcare proxy. But remember, that is not a reason to choose someone is just because they might be upset if they're not your healthcare proxy. From time to time, you should check in with your proxy to remind them of your wishes. And this especially becomes important if you are to get, for example, some kind of new medical diagnosis that would make it more likely that they have to act on your behalf. And then importantly, if your wishes change for any reason, that is an important time to update your healthcare proxy on what you are currently thinking. People's opinions on things like breathing tubes and CPR and feeding tubes and pain medicine, those can evolve as their journey progresses with whatever healthcare condition they're facing. So those are the kinds of things that you would want to update your healthcare proxy about. So the next steps are then to write down your wishes and share them. That is the best way for your healthcare. And this does not have to be, a notarized document, at least in the Commonwealth of Massachusetts. You can just write down what you'd like and make sure your healthcare proxy has a copy of that, of your wishes. You want to fill out the proxy or equivalent form in whatever state that you happen to be in, and make sure that your proxy has a copy of the form and or knows where it is. So if you haven't had a chance to give it to them, you could make sure they know where to find it at your home. Give your form to your regular healthcare providers, and typically this would be your primary care provider, or for example, if you are in oncology care, you would give that to your oncologist as well, to make sure they know who your healthcare proxy is and what your wishes are. And then for those of you who are MIT Health patients, we can help you with all of this. We can help you with filling out the form at your next visit. We have people who can serve as your witness, and we can scan it into your medical record, so it's all right there. If you want more information on that and have access to the forum, you can go to health.mit.edu/decisions. So we've relied this last month of Healthcare Decision Month, the month of April, on a lot of the great materials from an organization called the Conversation Project, and they have multiple free resources that can help. And we would really direct you to their website to see all that they have to offer. They have a conversation starter guide, a guide to choosing your healthcare proxy, your guide to being a healthcare proxy, and a guide for talking with your healthcare team, among many other resources that are available. I also, in thinking about this webinar today, wanted to point you towards a wonderful book written by Atul Gawande, probably about 10 years ago now, maybe a little more, called Being Mortal. Really a fantastic look at all of the things that go in and happen at the end of life, and the ways that we can do that better. So if you have not yet read his book, I've also listened to it, and he narrates it, and is a wonderful book. And we'll end with a quote from that book, which is, "Sometimes we can offer a cure, sometimes only a salve, sometimes not even that. But whatever we can offer, our interventions and the risks and sacrifices they entail are justified only if they serve the larger aims of a person's life." And that really speaks to your wishes. We can offer you all of the treatments in the world, but if they don't align with what you want for yourself, then we have to be having different conversations. So our wish for you is to make sure that you have your wishes followed through. And I think that brings us to the end of the presentation portion. And I think we'll bring Caitlin back on, and I will stop sharing.
Thank you, Dr. Stuopis. We know that this is a very thought-provoking topic, and it's one that requires a lot of reflection and dialogue. So we really wanted to spend some time answering some questions that we know our audience has. So I encourage you, if you have any questions, you can submit them to the Q&A. But I'll start with a few that came in. The first one being, is this permanent? If I select a proxy now and decide later that I'd like to change my proxy, is that possible?
It is always possible to change your proxy. So this document is meant to be easy to fill out, actually. So for example, in Massachusetts, it does not even require a notary public. Now, in some states it does, so it's less easy. But in Massachusetts, it's just a matter of filling out a new document to change the name of the healthcare proxy or the alternate healthcare proxy. So it is not meant to be permanent unless you want it to be permanent. Another place, where you might want to change your proxy is, for example, people will often pick their spouse as their healthcare proxy. But if the spouse passes on before you, then that's a time where you should think about putting a new person into the healthcare proxy form, so that if something comes up for you, there is somebody there who can actually speak for you on your behalf.
And I think you touched on this. Is it possible to select a proxy that lives out of the state?
It is. The proxy does not have to be local to where you live. It's best if the documentation is local to where you live, but the person or people can be wherever. The key thing is that we have to have their accurate contact information on the form and be able to get them in, the heat of the moment if there's a true emergency. Because remember, you're not going to be able to call them because a healthcare proxy does not go into effect unless you are unable to speak for yourself. So we have to be able to locate the document, and that's where, giving it to your regular healthcare team comes in. And we have to be able to reach that person with a good phone number, frankly, right? It's not like we're not going to be emailing them in the middle of the night in the middle of an emergency. We need to be able to call them and hopefully they would pick up. So.
Along that same line, because the healthcare proxy is a legal document, is it possible to use the document outside of the United States?
So every jurisdiction of the United States and subsequently every other jurisdiction outside of the United States have different rules about how they think about advanced care planning. So, it might be informative to the people there. So let's just say you were in Norway and something happened. Like the Norwegian health team, they have a different set of rules about who they would listen or talk to. They might not need a form at all. I'm not sure. But if they need a form, they might not be able to use our form, but they would feel more comfortable in absence of a form, at least knowing that you executed a form somewhere. It may not meet their legal requirements. I think, though, one of the more important things is if along with the form you have a list of like what you want for yourself, even that healthcare team, even if they don't rely on a proxy to make those decisions, they would feel much more confident making decisions, understanding what some of your thought out wishes in advance were. So, and again, in other areas of the world, it is exceptionally hard to call, if you were in Norway and you were trying to call MIT Health at 2 a.m. on a Sunday morning, if I was the doctor there, it might be very challenging for me to get that information, but we would, I think most medical professionals would try. So.
Yeah. All right, so let's see. Another question that came in, and I think the video did a great job representing this, but what are some of the qualities that you should look for when choosing a healthcare proxy? And are there individuals who should not be chosen?
Well, I've had a fair amount of experience with this as being the physician trying to work with a healthcare proxy. And I don't have nearly as much experience, of course, as an ecologist, for example. But I think in my estimation, and I think other experts would agree that the key thing is that the person you pick has to be able to decide, right? If it's clear to you that they would not be able to make a decision, even if it's a hard decision. So for example, a decision to withdraw life support if you had no chance of recovery, that is a very weighty and hard decision. But if they could never make that decision, but that was one of your things that you said that you wanted, if they can't do that, then they should not be your healthcare proxy. And so that's an extreme example of a decision, but there are some individuals also who can't even make a decision of, should I give them an antibiotic or should we give them IV hydration? Those are much more, I would say, more minor decisions in some ways. If they can't decide, that's a very challenging circumstance for them to be your healthcare proxy. I think the other thing is, if you don't believe that they're going to take appropriate sort of care with your decision. So there was an example person who was just like, don't ever let them do anything ever because, they're just, you don't want any of that. Like people who are too set in their ways to really be able to put themselves in your shoes with your wishes. If they can't do that aspect of it, they also should not be your healthcare proxy. Yeah.
And that resource, the Conversation Project, is a helpful guide, I think, in having some of those conversations about wishes.
Yeah.
Okay, so a question came in. Could you clarify, how does Massachusetts define incapacity when activating a healthcare proxy's authority to make decisions?
So I have not recently read this regulation in Massachusetts. However, in general, so if you were brought in after being hit on the head and you were concussed badly and you were unconscious. So this would be not an unusual example, I suppose, after a car accident, right? Like, I think in the short term, you would be brought into an emergency department in that kind of situation. You are technically incapacitated, but the first priority is not to go dig out who your healthcare proxy is to decide. Like, they would just be taking care of you. But then in the hours, after that happens, if you are still not conscious and there are important healthcare decisions to be made, they would then seek out whether you had any identified healthcare proxy to help assist the team. In absence of a known healthcare proxy, the medical team is always going to make their best medical judgment based on like the standard of care and what the prognosis is, I think, is the way to think about it. So you do I think one of the tricky things is when there's a little bit of time and assessment that goes on before we really want to go down the pathway of, oh, we need a proxy to start making these decisions. But there's certain medical diagnoses where it's obvious immediately that this person is going to have significant incapacity. And that's, for physicians and the healthcare team, that's pretty obvious early. So it's not a hard and set rule. It's more of a continuum is the way I would think about it.
That's helpful. Could you describe how a living will relates to a healthcare proxy?
So living will is a terminology that is used in other areas of the country is what I would say. And that is real. I think about a living will as the list of things you want or don't want, importantly. It can either be what you want or what you don't want. And that is, and some states will, in addition to having either a healthcare proxy, the decision maker identified, they will, or a durable power of attorney for healthcare, they will also want you to have a living will. Now, Massachusetts does not require it. Massachusetts basically says, we assume that you picked, Cecilia as your healthcare proxy and you've had a conversation with her and she knows whether it's written down or not. It's always probably better to write down your wishes in some sort of fashion or another. And the Conversation Project, again, has examples of how you could do that. But a living will is another name for your wishes, is the way I would think about it. But some states do require a separate living will document. Massachusetts does not.
Okay. And you mentioned how MIT Health could help patients with the healthcare proxy process. Are there any final tips or words of advice that you'd offer, our MIT community and our MIT Health patients?
Well, I think it's also important, by the way, I think I haven't emphasized this, is having a conversation with your primary care doctor or, a member of your healthcare team who you are seeing regularly, to, particularly, as we age or we develop certain kinds of chronic health conditions, how, to have a conversation with them about what the prognosis is. We as physicians try to be honest about things like that, like prognosis, but it's challenging because none of us wants to give up, right? You, the patient, don't want to give up. I, the physician, don't want to give up. But if I know that this is going to end not in full and meaningful recovery for you, I'm obligated ethically, I believe, to tell you so, right? And you should ask questions, doctor, am I going to recover from this? And if your doctor says, no, I don't think that you are going to recover from this, then that's the time to have a conversation start to be thinking about how you want the last, end of days to look like for you, particularly for some of those kind of terminal diagnoses. Some things are very sudden and conversations can't be had, but I think doctors are often struggling to try and sort of not have you think that they're giving up on you.
Mhm.
And your potential for recovery. And we often talk about things like, well, most patients won't recover from this. And when we say most, you might be thinking, well, that means 52%, but really in our head we think 99% won't recover. Like, it's important for you to ask questions, like to get more specificity, and be comfortable with knowing the truth and what your medical team's opinion really is. It does not serve anyone for us to provide false hope, I think, is the thing to think about. And it's not to say that one person won't recover, or maybe even 10 or 50, but what is the likelihood? And because that informs your decision making, and you might choose to do something different as you are getting towards the end of your life with your time and your resources. And you might decide, for example, not to keep working. If you really knew that you had X number of months left, you might decide to do something different with your time. And we want to help you with that and support you with that, but we don't want you to feel like we're giving up on you. But it is tricky sometimes to be very honest in a way that patients don't feel like you're giving up hope for them. But what I hope for, and what I've seen with the passing of both of my own parents, is you want the last days you have on this earth to be the best possible days you could have, right? And some of the things that we can offer you in trying to treat you and have you recover may not actually lengthen your life and might shorten your life. And those are really important conversations to have.
Well, that was all of our questions that came in. And Dr. Stuopis, I want to thank you for bringing this information and conversation to the MIT community. We also have a lot of information on the MIT Health website, as well as a podcast. If you're interested in learning more, we have a podcast called Healthcare Proxies 101 with two of our clinicians. And as Dr. Stuopis mentioned, having a conversation with your provider, we can also help facilitate the official form process as well. Thank you all for being here. Keep your eye out for the survey that we mentioned. It's very brief. And again, we encourage you to share any feedback, but also topics that you'd like to see us feature in the future. Thank you.
Thank you, everyone. We really appreciate your time today, and let us know how we can help you. Bye-bye.